Welcome to the 1% Doctor Podcast. What separates the good from the great, the standard from the extraordinary? It's mindset, it's execution, and it's the relentless pursuit of growth. I'm Adam Lamb. I'm your host. Welcome to the show. Welcome back to the 1% Doctor Podcast. I'm your host, Adam Lamb. Today, we have a very special guest, a good friend, and just somebody I look up to, and just an expert, tip of the spear guy. And we're going to dive into some of the topics around regenerative medicine and all the great things he's doing. Dr. Myint, welcome to the show. Great to see you. Great to have you on here. And I'm excited for all that you're able to share that the guests are going to get from a value standpoint.
Thank you, Adam. Great to be here. Thanks. Appreciate it.
Yeah. Tell us what led you to want to get into medicine.
Good question. So my dad was a physician. He was a physician in occupational medicine. He trained in London. We grew up in Florida. You know, I spent a lot of time in his office. I have two brothers. The other two had no interest in medicine. So I just sort of gravitated and watched him perform and watched how he dealt with patients and how he treated people. So from high school on, I was exposed to that world. And I knew that at some point I wanted to be in that world, helping people get into where they want. Didn't know what I was going to do, what specialty, but I liked that environment. It was very comfortable for me. And so that led me on the journey to where I am now.
And so where'd you grow up?
I grew up in Florida.
Okay. What part?
I grew up in Tampa.
Oh, okay. I don't think I knew that. But you spent some time in Michigan, right?
I did. So I was born in Burma, in Myanmar. My whole family was born there. So we were sponsored to come to the United States by a physician in Marion, Ohio. So we came to the United States, and then from there we moved to different states, and then ended up in Tampa, Florida. My father had his own practice, and he was involved in occupational medicine down there. So we grew up there, went to med school down there, and then I ended up in Michigan for my residencies and my fellowships. And that's how
I know you and I both had some Michigan roots, right?
Yes,
and
that's
your
correct. That's
wife
correct.
too, right?
That's correct.
Is your wife?
Well, she's from New York originally,
Okay.
but she came into Michigan, and from there we came out west.
Yeah, and now you're in Las Vegas and LA. You split your time, right?
That's correct. So I have a practice in Los Angeles, and I have a practice in Las Vegas as well. So I go back and forth.
And so talk about a little bit what you do today, because it's unique. It's not a mainstream, it's not like a primary care internist necessarily, right? So talk a little bit about, and I think you've gone down the path of a specialty within a specialty, right? With all of the things that you do. Like, let's break it all down for us with a little bit, like when going into medical school or residency, the path you went into. Let's talk about that a little bit to what led you.
I did my medical school, ended up in Michigan to do my residency in ophthalmology. And my specialty is oculofacial plastic surgery. The few of us around the country, and there's a limited of us around the country that do this discipline, where we specialize in plastic surgery around the eye, the eyelids, eyebrows, and the face and the neck. And
a popular one what's the name where they kind of, it's you almost like cut above the eyelid, and it kind of gets that, like if you have bags above your eyes, like what's that procedure called?
I know blepharoplasty.
Yeah, and it's something with the blep, and it's been pretty popular, right?
Yeah, blepharoplasty has been around, for a while, and most plastic surgeons, all plastic surgeons, and there are other divisions of medicine, surgical, that intervene in this blepharoplasty world, and people do, which is removing skin. It's actually a little more involved in that, but majority of the people just remove the skin. But yes, that's a bread and butter common thing that people come to me for, uppers and lowers.
I feel like it's more popular. Maybe it's just because I'm 45 now, and so like there's just more people I know at that age getting it done. Like as you get older, right?
Yeah, and you look great for 45, by the way. So most people, yes, it depends. Late 30s, I've done it on late 30s. Depends. There's congenital reasons people have it. There's other causes of it, but it's about 40 to 65, 70. And most people are in that range from gravity and different reasons. So I have a practice where I specialize in those areas. But to get to that discipline where I am. You have to go through the world of ophthalmology to understand the anatomy, physiology of the eye to understand how to do plastic surgery around it. It's no different than GI specialists and urologists and cardiologists. They all go through internal medicine. And then from there, they specialize in the practice. Where in our world, there's glaucoma, there's retina, and then there's plastic. And that
Mhm.
plastic division comes from ophthalmology. So I did my residency in Michigan in ophthalmology and did my fellowship in plastic surgery in Michigan. And then joined the group that trained me, was with them for 12 years, training other doctors around the world in my area. Then I branched out and came out west to
So
LA
you were
and
in
Vegas.
Michigan for 12 years?
I went to Michigan and trained and stayed there for about 10, 12 years.
I didn't realize you were there that long.
Yeah,
That's
11 years.
we
Yeah.
never crossed paths there. We
We
crossed
never
paths.
crossed paths.
Yeah.
It was meant to be at this point.
Yeah, that's right. I agree.
But yeah, so I did that, and then and moved out because I was planning on branching out, and I was very, very fascinated. Even at that time, this was late, these like early 2000s. I was always interested in modalities of helping even cosmetic patients, but more importantly, in health and wellness, using patients in regenerative cells. Back then, we were talking about this stuff. We didn't know what it meant. There were a lot of people that were already ahead of the curve. But I was always fascinated with that. I didn't know how I was going to do it, but it was interesting to me. Just like it was interesting when I was very young, walking in my father's office. I just knew there was a passion there. There's a connection. I always had a connection with that world, and I wanted to do something with it. So I decided to come out to the West Coast to try to explore that.
And so what do you think that was, going on your own and having your own practice and leaving a group? Was there some fear in that, like learning, like, were you like, how do I run a business? How do I like, was there certain aspects? I think, a lot of the docs listening, and, just I work with a ton of docs, and a lot of them, that fear of taking the leap from like, what they know and what's comfortable, and someone else does a lot of the aspects of the business side. They're just there to practice versus, you got to learn a little bit about business when you decide to take the leap and go on your own. And I think obviously today, and I haven't met many docs that regret doing that, but what did you have? Did you have to like learn stuff? Like, were you nervous? Were you almost just jump blind and said, I'll figure it out on the way? What was some of the experience that you had to deal with prior to making that move?
All of the above.
Yeah.
It's, you're a successful business guy. It's never easy. It's scary. It's scary, launching out in the Wild West and trying to figure things out. Some people have an intuition. I have a lot of students that rotate with me, a lot of residents, and we have these discussions. That's out of the classroom. It's, how to start a business and how are you going to work this and how you go independent. And there's a lot of nuances. Some people just have a knack for it. They have a blueprint for that. They know how to walk in to that arena and take off, and others struggle and others have to learn. So it was a struggle. It was a struggle for me just moving forward and trying to understand not only the landscape of what I was trying to do, but to understand how to coordinate that through the business acumen.
Yeah. I mean, because
And it takes time.
you got to be a team. You got to shift your leadership skills and understanding, like, how do I market? How do I get clients? How do I organize schedules and partner with, with a lot of what you do, anesthesiology, like you have to, there's like other things that have to come into place. I assume that, doing all these things of like doing it on your own versus showing up and doing a procedure, which, it's obviously a little bit more of that, but a lot of times it's just showing up, doing the procedure and leaving versus like potentially having to coordinate the whole thing, at least hire the team that can coordinate the whole team or the whole thing for you. And that can, I think that could be
Yeah,
intimidating.
100%. 100%. And also surrounding yourself with the right people. And I was fortunate to have people in my life that have really helped me and guided me in certain directions. And that really helps. That really helps in the beginning.
The relationship capital is huge.
Yes.
Talk a little bit about, so you went from kind of being fascinated with like the regenerative side of things. And I'm actually super interested because, I know a decent amount about regenerative medicine, been in the space since 2019. But as it comes to like the eyes, it interests me, like just wondering what kind of things can be done. And you can share some stuff that you've learned or that you're speaking on or doing things. Tell me a little bit about that venture as we're kind of going down the regenerative medicine conversation as it pertains to some of the stuff you do, and also understanding, I know that regenerative medicine for the whole body and all these other things, but tell me about like what you started discovering and unpack that a little bit.
Yeah. I think that journey um, Adam, for me, really started to hone in when I started to explore it on myself. Because I have an autoimmune condition. I've had it for years, been through a lot of physicians trying to figure out how to work through it. And most of the people that I've been to was a traditional way of thinking of here's the medications, here's how you do it. And there's nothing wrong with it, but the direction we always went. But I always felt that there's some other ways to handle these things. If you can touch into the body and figure out what the reasons are and not just put a band-aid on it, but let's figure out the cause. And
Hmm.
so as I started exploring, I got into this world of regenerative medicine and I started doing it on myself. And I noticed some significant improvements symptomatically, measuring metrics and things. So I knew I touched into something finally that personally has affected me. And my thinking was, if it's affecting me, it's got to be able to help other people in so many different ways, right? And you know that you've done this. And so that's when my partner and I started to get into the world and launch the Vitality Forever Clinic, aside from my plastic surgery clinic. But to answer your question, yes, I think now as I dive into it, because I'm giving a lecture at the San Diego Arts of Regenerative Therapy, which is a very interesting conference in San Diego, 3 years old, 3 or 4 years old, and some of the biggest, brightest minds of the world are coming and talking about this space, which is blowing up, as you know. I mean, it's like a bullet train. And I think the future is this in so many different ways in cosmetics and regenerative and wellness and health. So in my world, I'm trying to explore how does this space affect us as surgeons, affect us as in wound healing, and affect the patients in terms of overall healing. And so it's still an evolution process. I don't think there's any protocols out there, but for eyelids, for example, my talk is on using microfat and nanofat and those kinds and stem cells and growth factors to help with the healing of the eyes. And how do you reshape it? How do you restructure it? How do you give it volume? How do you make it more aesthetically pleasing outside of the traditional nip and cut way? Really what we're trying to explore. And with me, it's just using these regenerative modalities into these areas to see
I
what
had a,
happens.
I had a friend recently get a buddy of mine. It was like PRF, I think is what it was, like almost like where it's like PRP and they're doing like underneath the eyes. Because I saw him, I looked different. I was like, you look different. I was like, maybe you look younger. And he's like, I had this PRF thing, it. So I don't know. Does it work? Does it work for everybody? But I think it probably goes along the lines of regenerative medicine, collagen, or it's kind of calling the collagen to the area. I mean, maybe you could describe a bit more of like what that does specifically.
Yeah, the PRF, PRP, they're all good stuff. I had somebody who was asking me the other day, well, I heard this was bad. I heard this was bad. PRP is not good. I think all of this stuff, to a certain point, they're all good. Right?
Yeah.
These are all little interesting things. PRP was huge when it came out. Well, we've been doing it for years, but I think when it was in social media, it blew up and everybody started. We've been, this, we've been doing it for years. PRF, it's the PRFM. And then, like exosomes and stem cells, and now the future is mitochondria. There's so many things happening. There's so many things. They're all, I think, good. What's fascinating is if you can use these modalities in conjunction with each other,
Yeah.
that's powerful.
Yeah.
That's powerful. If you use them a la carte, which is okay, but there's no question that I have seen, at least in my practice, that the marriage of some of these exciting modalities really is where it's headed. And how do you do it? What parts do you use? How much do you use?
Yeah.
Where do you do? All these things are what we're trying to explore.
Well, there's some people that, I've been doing this same, kind of the regenerative medicine space for a long time. I'm a huge believer in it. I do an exosome IV about every quarter. If something hurts, I'm thinking, depending on the severity of the stem cell, doing it an injection. But I also monitor my blood work about every 2 months and make sure, we always had this saying is you don't want to put like crystal, clear spring water into a rusty can and drink it. Right. And so I think a lot of times, because people ask me, hey, I have this knee issue, do you think stem cells will help? And I'm like, well, you're 100 pounds overweight, you have type 2 diabetes, you drink alcohol, 5 drinks a night. I'm like, there's some things that need to go, to work. Will it help? Like, is it like you said, is it good? Sure. Could we make it way better by changing some other things and creating alignment, right, with that process? Great. Right. Like that, like we absolutely can. And so I think there's part of that aspect of it. And so I know that you have outside of your practice, you also have another clinic because you're so passionate about this, the Vitality Forever, right? And talk a little bit about that, like the mentality behind, how you view sort of wellness and optimization and things like that for patients.
Yeah, I think you nailed it. This whole concept, how you choose to play in this landscape, it depends on where your passion is and how you slice and dice it. They're all good. Some people concentrating on hormone replacement, some people concentrating on just stem cells or injections. I think they're all good. My feeling has always been, even back then, is how do I mine the human body for regenerative cells to achieve maximum longevity? And, I think this term of anti-aging is sort of old hat. I don't think it's anti-aging. It's longevity is where we're headed towards. Is how do you create that? And so at Vitality, we're trying to tap into those resources. How do I get my patients, get things from them, whatever it may be, and we have protocol to give it back to them from all different angles. And I think for my patients, that's a sense of safety and security. Because I asked them, I've taken polls, and they would much rather, to talk to me, take something from me. I don't want to get something off a shelf. I don't know where it's coming from. They're becoming smarter, the consumers. And they're asking more questions now than they ever have, at least to me. It's like, where's that bottle from? Like, where do you guys get that? Where does it come from? And I have to explain it. I start thinking it's very interesting because now they're understanding, well, it's coming from somewhere. What if something happens? What if I get it from me? Let's just get it from me. Sure, I can do that. And that's sort of what, we're trying to explore.
Yeah. And how can we do, and that's the goofy thing, two parts in that, to unpack for people that may not understand this. A lot of people ask, yesterday, literally had a guy ask me, hey, what do you know about setting up a stem cell company, regenerative medicine company in Mexico? I was like, I don't know about it, but I know a few people. So I asked a few people, and some of those things are, it's like some of the stuff that we can do there, you can do here. Some you can't, right? Or any, you could say Panama, Colombia, some of those things. But also, like you said, to the point, where's that bottle come from? Right. So like in the event you're doing, you're talking about like autologous versus,
yes. Yes.
What's the other one? Just slipped my mind.
Getting it from, yeah,
but
that's correct.
Yeah. And so whether it's from self or, from a donor, basically. Right. And so what some people understand is if you don't know where that came from, that can be pretty scary. The other thing that's goofy, but that you can do, it just depends on the severity, or, how deep you go into it. Like a lot of people don't understand how goofy our medicine is, but in high level theory or a high level, just, explanation of this, just so it sounds kind of silly, is in many cases, depending on the situation, if I take let's say like your blood from you, and then I go and add a bunch of stuff to it, technically in our country, it could be considered an unapproved drug, which is absolutely bonkers. Right. And so a lot of times when people are like, hey, I got to go to, if I want to do regenerative medicine, you don't really have to do it. And here's the great part. That is because of, regardless how you feel politically, but this new administration coming in with RFK Jr., who's big on regenerative medicine, stem cells. He's big on, he's getting these companies to take all these, we've known for years, are poisonous, ingredients in our food, in our water, all this kind of stuff. Like when you take all of that stuff and realize like the levels of poisons and toxins that we need to just get rid of our body, it's awesome. And so I think I'm super bullish in this regenerative medicine space. It's only going into the path of areas like what you and I are in and what you and I are talking about, to open up the door in conversation. Same with peptides. I'm not sure if you do much with peptides there, but like that's becoming a big conversation. And the funny part about it, because I talk to these private equity groups too that are like, hey, Adam, they're realizing like, hey, there's something on this wellness thing. They're realizing, hey, people don't want to just go take a pill to mask their symptoms. They actually want to figure out the problem and fix it. Like, what do we do? How do we create a program around that? But what was interesting is some of these guys, I said, hey, remember when we talked 5 years ago and you said, no one's going to inject themselves at home, right? Like, no, that business model will never make sense. Well, fast forward, GLP-1 came out. Well, and we had the pandemic here, which opened up more of a telemedicine, virtual idea of medicine, which, I'd been at the time for almost 10 years. But it opened the door to people being like, oh, that's pretty easy. I can just hop on and Zoom with a doc and like, he can help me out. And, in some cases, obviously you can't do surgery and certain things over that. And in person is vital for many things. Some stuff can be done virtually. So it's like we saw people like, oh, I can see my doc a little more conveniently. That's cool. And this GLP-1 thing came out. And, if I would have told you 5 years ago that stay-at-home Susie is going to inject herself with a needle and her, subcutaneously in her midsection every week to lose weight, most people would have said, nope, no one's ever going to adapt to it. But then look, it's become the biggest craze.
Hmm.
Now, and that's the challenge with a lot of these peptides is because the FDA goofily went and mislabeled them high risk or whatever. And so like some of them are very hard to get from a pharmaceutical standpoint. So what happened is then there's these research companies, right? And so a lot of people though just still have trust in the research companies. Some of them, I think you have to look at what you're going to get into with that. But now you have stay-at-home Susie, who you never thought would use a needle, who has no problem injecting herself once a week with that. Now she's going to a research peptides site, reading how to dose it and do it on Reddit. And I hear it because it's like, I have a daughter in cheerleading. And sometimes I overhear these cheerleading moms talking. I'm like, where is this? What's this lady? How does she know about Retrutide? Like all these other things, right? And so, and the reason I bring this whole thing up is that because we're in a space where where information is so readily available and the doors are opening, more people are waking up, more people are talking about all the value in regenerative medicine and seeing medicine in another way. And that's why I'm so excited and glad you're talking about it, doing it. But now's the time. I mean, this is a new frontier that we're stepping into, especially over the next few years. It's going to unfold where I think people that are not like actively looking how to get into regenerative medicine, learn how to do it real well, go to these places to hear someone like you talk and speak and learn about it. You're going to be behind. You're going to miss the boat, right? Because it's going.
Yeah. Yeah, I 100% agree with you. I think it's moving very fast, faster than we think. And you're tapped into not only the regenerative, you're tapped into the business side, you're tapped into the PE side. There's a lot of movement happening now, and people are trying to figure out, okay, what's going on here? How do we get on this? What do we do? How do we do it? And I think once you start understanding how human cells work, because this is all about cellular reset, right? Not about bandaging. It's about taking your cells. How do we reset them? Because we know we can do it. It's been proven.
Oh, yeah.
Molecular factors, so many things. How do we reset them and then push them forward to make the changes we want them to make for all of our organs, for our brain, our skin, our hair, our health? One of the things that we're doing for skin is, it's no different than the microbiome of the gut. And that concept is in the skin. And, we have, we're a big believer in making that ecosystem balance, and when that ecosystem is off, everything is off. And there's regenerative influences around that by using things that affect the microbiome. So we have a line that we're using, we're the only ones in the country that carry that uses this to help patients with that, Editrix. And so there's a lot of things out there that I think we can tap into to bring it into a human being to get them to move to a different direction. Beauty of it. And when that happens, and you've seen it happen, I've seen it happen, it's amazing. It really is amazing to see them change their posture, see them feel better with more vitality, more energy. Their skin looks better, their hair looks good. There's so many different things that are happening. It's like, wow.
Yeah. And like we were saying, I appreciate the compliment earlier, but like at 45 years old, I'm the strongest I've ever felt. My skin's the healthiest. Like there's just, I feel good, but I'm doing a lot of these modalities. I'm also doing the diagnostic to pay attention to that stuff. And there's a lot of lifestyle stuff, right? Like making sure you're drinking enough water. I do, infrared saunas and cold plunges and like all these ground, there's a zillion different things out there, but all of it adds up. And I think, like what you're talking about with your clinic at Vitality Forever is like you're bringing somebody in and exploring like all that's possible for their health and managing that longevity piece for them. So it's like versus just a one, like, I'm going to go do this gut program, or I'm going to go do this. I'm going to get on testosterone. Like, someone asked me, what do you think about testosterone? Love it. I think a lot of people should be on it, but not everybody should be on it. And there may be some other things that we need to do to look at and why, if you have testosterone, why is it low and what was causing it? And all these other variables that we can look at. Like there's just the medical community, I think has done a great job at getting us to think like, give me the pill to solve it, but it's not going to fix the bucket. If you just, it's like taking a piece of gum and plugging the leak, like eventually something else is going to happen with it. And so I think having the mindset and, a physician like you, and also having a clinic like Vitality Forever, which just kind of speaks for itself, and having that vision of someone like come in and like help reshape the direction of my body. Like you said, all the way to a cellular level. Like how do we change that direction so that I can age better, right? Reversing your age from a chronological standpoint, but changing that all the way down to the mitochondria, its cells, and all that stuff.
Yeah, you said something very interesting, which is, you're doing the epigenetic testing in order. So this is all about rehabilitation, right? This isn't a come in and do an injection and leave. I have a lot of people say, can I just have it? If you want to do this, fine. There's a place across the street. You can just do that. But if you really want to work out your muscles and you want to look good and ripped, you're not going to go to the coach every 8, 9 months and say,
Right.
listen, I just want to, can you work? Well, you're not going to change. And the coach is going to call you and say, where are you? You got, be here next week. I got to work on your muscle.
No,
It's the
you're
same
right.
concept with health and beauty and hair and everything about human being. If you want that, which is amazing, you need to be in that space and do the job correctly. So what we're all about is longevity. It's rehabilitation. It's staying in a plan. Without a plan, it's not going to work.
Right.
It's just not one thing and you're gone. It didn't work. Well, it didn't work. You just did it 8 months ago. And it's being consistent. And once you're consistent and you see it, now it's like, oh my God, when can I get the next one, the next one, the next one? It really makes those changes. And so you're right. There's metrics that have to be done. This isn't just coming, let's give you a shot or infusion. Let's check your organs. Let's check 19 organs. Let's check your brain, your cells. Where are you now? Where's all your metrics? Okay, let's put you on this thing. Now look at it. 6 months later, look what happened. What happened to your heart, your liver, and your kidney? It's a visual, that's an understanding. It's a psychology for the patients. They get it.
Yeah.
When that happens, they get it.
Yeah. They're more likely to stick to it as well by seeing, there's one thing of feeling different or, getting on a scale and saying, oh, look, I've lost 10 pounds. Cool. But like, where's your cholesterol? Where's your, inflammation? All these other things that we should be paying attention to. And like you mentioned, like the entire thing, because otherwise there's plenty of really fit looking people that drop dead way too early, right? Because maybe they missed some things. Right?
Yeah, we're incorporating all of that in the next phase in surgery. We're trying to, when somebody comes in to have surgery with me, we're trying to wrap this into the surgery to see how we can make them accelerate in terms of their healing, not only their wound healing, but the overall way they feel. That's really fascinating to me.
Yeah. I mean, surgery recovery, so many of these things in regenerative medicine that can help with surgery recovery, even wound healing. I don't know how much you've looked into that. I've spent some time in this space of some of these amniotic skin grafts now that they're using for non-healing wounds. I've been doing some stuff consulting that space for the last couple of years, and it's crazy. I mean, people that have had bed sores or diabetic non-healing wounds for like 18 months, 2 years. And it's like day-to-day people. No one knows it, talks about it. It's not attractive. Unfortunately, they're usually people that financially can't afford a lot of great medical care. And now they have like they're essentially like regenerative medicine skin sub patches that are like healing 2-year-old wounds in 7 weeks, right? I've been paying attention to these studies, and it's amazing. It's just not as often talked about, right? So I'm excited to see these different areas of health that unlock. And, I think in the beauty side of getting some aesthetic things done, there's a certain financial community that it's a little easy to and more accessible to, but I'm excited too, that as the research proves, which, what you and I already know, and it kind of trickles down into more mainstream stuff, and we get more people off drugs that are masking problems and get them into more therapeutic treatments. And like you said, programs to actually get results that sustain and they're a better health and all those kind of things. I'm excited for that future. And I think the work that you're doing is going to just help continue to plow the way for that road.
Yeah, just on piggyback on it, there are in South Korea and also in Turkey, they're doing where they're injecting exosomes into the wound in their research, and the results I've seen are remarkable. What it does to the collagen, what it does to the fibrin, and how that epithelialization of that wound happens in a rapid fashion just by putting in these vesicles that have the DNA and the messenger RNA and everything to cause it to heal. That's the power of it.
Yeah, we had a couple major medical groups back in the day. I won't use names of anything, but that saw what we were doing on the regenerative side with regenerative medicine, peptides, things like that. And they would refer, this I kind of got to meet a lot of high profile people, a lot of their high profile post-op folks to us. It was kind of like, it was like a within the inner circle type thing is how they would do it. It wasn't a standard procedure for them because we'd shown to cut healing time in half every time. They'd follow up, they're like, this is already healed 6 weeks instead of 12, like stuff like that. So it's like we got to see some of these things. And so it was kind of, we had that relationship kind of almost like backdoor, hey, call these guys if you want, choose that path because there's a lot of opportunity to do it. So it's like you and I both get to have seen this stuff and it should become standard of care. And I think the reason it hasn't yet is because big pharma hasn't figured out a way to make a crazy amount of money on some of this stuff. And to your point, like we talked about earlier, is these are a lot of this is cells that exist within you, right? So to take the cell out, so that maybe money in the modality and some of these things, and obviously in the treatment, but it's not a $1 trillion drug, right? And so I'm hoping that with new administration and people waking up to what's possible in our own bodies, helping us heal, that this becomes more of a mainstream standard of care. Like, let's start here or add this here. And it becomes, also more affordable because, most of the stuff that you and I do is all out of pocket, right? A lot of it's cash pay. And so there's, we hear so much politically where someone's like, hey, there's a income gap. And it's like, well, look, you could help those people too by changing some of these healthcare laws to promote longevity and healthy living and things like that. But I don't see them doing it yet, but I think that'll be coming down the pike. Guys like you and I that have been advocates for this longevity and regenerative medicine will be able to help even more people do that. I wanted to, before we hop off, Dr. Myint, I wanted to give a chance to, if anyone wanted to, check out your clinic or work with you, inquire more, you're an amazing physician. And I've sent people your way because I believe in you and what you do and your team. We'll put a lot of this stuff in the show notes, but is there anywhere you want to send anybody, that's listening right now, but we'll put all that information in the show notes.
Yeah, I mean, they can certainly call. I mean, they can get on the website or drmyint.com or vitalityforever.com, and they'll get a lot of information on there in terms of what we're doing and what we're trying to do in terms of that field. And they can move forward with that. That'd be great. That'd be fantastic.
And I'll spell it for you because I've misspelled your name 100 times, but it's Myint. I don't know. For some reason, I remember when we first met, I would always goof that up. But yeah,
it's DRMYINT.
Yeah, drmyint.com. Check him out. Hey, Dr. Myint, it was awesome seeing you. Awesome having this great conversation with you. I think a lot of people found a lot of value in this. So thank you for being a guest and good luck I know you're speaking later on this week. And those people are going to be fortunate to hear you speak. Excited for you. So thank you so much again for being a guest in the 1% podcast.
Thanks, Adam. As always, I appreciate it. Thanks for having me. And I love the show, what you're doing in the landscape, and keep it up.
Thanks, brothers. Everyone else, thank you for tuning in to the 1% Doctor podcast. I'm your host, Adam Lamb. Please like, share, and invite a friend to come listen to this podcast. We'll see you next time. Thanks so much for tuning in to this episode of the 1% Doctor. Please be sure to subscribe to the show where you're able to consume more podcasts, get more value, and learn more about doctors potentially just like you. Please tell a friend, review the show, and we'll see you in the next episode.